The child is suddenly hot and crying, and you're panicking. You don't know which fever is normal. You don't know which one is dangerous. Let me break it down clearly for you. Hello guys, welcome back to this channel. This is Dr. Lovable on the Mom Health Desk. Here we talk about everything you need to know about motherhood, about child's health, even about pregnancy. So if this is kind of content you're interested in, please hit the subscribe button. So today's topic, we're going to be talking about fever. Now here are the things we're going to be talking about. We're going to talk about what is fever, the causes of fever in babies, what to do about fever, and when to worry. So what is fever? Fever is simply a temperature from about 38 degrees Celsius and above. Most times it usually is 37.5, but sometimes there can be mild raises in temperature, which will give you that 7.5 spots. Whenever you're having anything from above 38 degrees Celsius, anything from 38 degrees Celsius and above, that is fever. Now, what are the common causes of fever in children? One of the common causes of fever in children is infection. Inside the infection, viral infections are the most common. That is why you see most times it comes out with cough and cold, and at the end it goes on its own. Viral infections are one of the most common causes of fever in children. Aside that, there can be bacterial infection. There can also be parasitic infection like malaria in the malarial endemic areas. So these are some causes of fever in children. Now, aside infection, vaccination is another thing that causes fever in children. So you notice that your child is having fever immediately after vaccination. It's totally normal. So it's expected. All you have to do is to give that child paracetamol to reduce the fever. Within 24 hours to 48 hours, the child is going to stop having fever. But if you notice that the fever persists after 48 hours, please, you need to see a doctor for evaluation, because it might not just be that vaccination, something else might be going on. Then, I want to add this. In your mind, you might be thinking that teething is another cause of fever. No. Teething does not cause fever. Instead, teething will only lead to a raise in body temperature, which when you feel it, you will think it's hot, but it is not fever. If your child is having serious fever while teething, you need to see a doctor. So now, when should you worry about fever? If your child is less than 3 months of age, then there is need to worry, because newborns cannot fight infection. Any little infection can lead to sepsis in newborns. So if your child is less than 3 months of age and has a fever, please see a doctor. If your child is having difficulty in breathing, you need to see a doctor. It is not something you can manage at home. If you don't know how to identify difficulty in breathing, you can take a link to watch my video on signs of respiratory distress. This will help you identify if your child is breathing properly or not. Feeding is very important in children. So if you notice that there is reduced feeding in your child, you notice that your child is suddenly becoming weak, sleeping too much, then you need to see a doctor, because it is a sign that this child is not responding very well. So you need to see a doctor. You notice that the child is vomiting and having diarrhea, then you need to see a doctor, because vomiting and diarrhea is something you should not joke with in children. It can cause dehydration very quickly. In my next video, I'm going to be talking about the signs of dehydration. So please, if you know that your child is vomiting or has diarrhea, then you need to see a doctor. To avoid late presentation, we've had cases where parents came in with their children who were already in hypovolemic shock due to dehydration. Sadly, we lost the child because there is no magic you can do. So please, parents, don't joke with your child's health. If you know your child is vomiting and has diarrhea, please come down to the hospital. Notice that the fever has been on for about 3 days. You're giving paracetamol, giving anything, and it is still there. Then you need to see a doctor, because it's no longer something normal. You need to know why is this happening. So yes, mothers, if it has lasted more than 3 days, you need to see a doctor. Or you notice that your child suddenly starts convulsing or having a seizure, then You already know that that's not something you should keep at home, right? So good. You won't need to see a doctor. You need to be worried because that child might be having febrile seizure and it is not something you would like. So now, what are the things you are going to do as a mother to help your child who has a fever? Number one is check the temperature. Temperature, I don't mean put your hand on the body and check if the body is hot. No. Check the temperature with a digital thermometer, meaning that every mother must have a thermometer at home. Every mother must have a thermometer at home. A digital thermometer, you check it and you give you the accurate temperature. Because most times, what you think is fever by touching the body and it's hot might not be fever. Sometimes there might be a little increase in body temperature, which will make the body feel warm, but it is not fever. So learn to use a thermometer to check your child's temperature. Second thing you will do is give paracetamol. Fever is not something you should leave in a child untreated or unattended to. You need to treat every fever. So you give paracetamol. And one thing I've noticed that most mothers don't even know the right paracetamol dose to give. They are still giving your 1-year-old 2.5 ml. So I made a video on how to calculate the right dose of paracetamol. So click that link in order to watch that video and learn how to give the right dose of paracetamol for your child, because this is very important. It's something every mother should know and should do. Another thing is dress your child lightly. Do not wear so much thick clothing and do not also overexpose. But dress the child lightly so that they can be exchanged. When the child is too covered, it can increase the temperature more, which will increase the risk of a febrile seizure. When the child is also having a fever, you can take a sponge. The sponging is use warm water, please, not a cold water. A cold water can actually be too cold for the child. So use a warm water with a towel, use it to clean the baby's body in order to bring the temperature. Do not self-medicate. I keep saying this, don't self-medicate. The only medication I have approved that you can give is paracetamol. Aside paracetamol, nothing else. Don't self-medicate. If the danger signs are positive, then you need to see a doctor, like I said. Aside that, do not give medication you are not sure, especially in children. Children work by doses. Any wrong dose can cause damage. Any wrong drug can cause damage. So please don't self-medicate in children. If you found this video helpful, please hit the subscribe button, like, comment, tell me some of the things you did when your child had fever, some of the experiences you've had, so that mothers on this platform can also learn from your experiences. And please share this to mothers, share this to fathers, share this to friends, share this to family. See you next time in the next video. Bye.